Sculpting the lower part of the face is possible through a surgical procedure. This procedure is called buccal fat removal. My name is Dr. Alawi, and in this video you will learn the positives and negatives of this surgical procedure and what can be achieved through it.
The plastic surgeon.
Years ago, the trend was to shape the face features and remove the fat from the cheeks in what is called buccal fat removal. In today's video, you will learn all the facts about this procedure and this surgical intervention. My name is Dr. Alawi, and in this channel, we talk about plastic surgery. I'm very happy to have you. Please share the video with your friends and people around you and subscribe to the channel. Even little children have an obvious large-sized cheeks area, and this depends on the facial anatomical structure, which is in exactly the middle of the face. It's a fat body located in the chewing muscle area and extends inside towards the mucosa. This fat body can be visibly big in the first few years, but its size shrinks over the years to some extent due to facial growth. This fat removal in the cheeks area includes reducing this fat body or removing it completely. This area is surgically reached through mouth to remove the fat. As a small incision is made, then the fat body is located. Finally, it's reduced in size or fully removed. This fat body is located under the chewing muscle towards the mucous membrane. Using the surgical oral axis, we can have many advantages, as the incision and the scars that will form are invisible. Reaching this fat body externally is surgically hard. Thus, we can know exactly the location of the fat body well through local anesthetic, and after that, we usually can operate the surgery in a private clinic, and it takes about 30 minutes. At first, the local anesthetic is applied in this area. Then once the patient is anesthetized and no pain is assured by the patient, we can start operating by doing the incision to access the fat body and then locating it and finally reducing or fully removing it. The surgical intervention in this area is associated, of course, with risks, and this is usual in all surgical interventions in the facial area. In this area, for example, there is the salivary gland canal, which keeps the mouth wet, and we have to avoid it and know exactly its location not to damage it. The general risk of this operation is like any operation, like bleeding during and after the operation, in addition to infection because there is a connection with the mouth from the inside. The impacts of buccal fat removal or the fat body removal include making cheekbones and lower jawbone prominent due to reducing the size of the middle of the face with the removal of the fat body. Some patients have also underskin fat, and in this case, we group the two procedures through underskin fat section. That is why talking with the patient in such operation is very important to identify the problem and understand the facial dimensions after the operation. When removing this fat body is not enough and does not achieve the patient's goals, then we can, in some cases, perform an underskin liposuction. This operation has some risks, like damaging some functional structures like nerve fibers, which are responsible of innervation of the facial muscles. For that, the surgeon expertise has a crucial role in this operation to get an excellent outcome. At first, some swellings may appear. The stitching thread for the wound through which we can access the operation area is of special kind, as it melts by itself, so we don't need to pull it out after the operation. It may take several days for the swelling to subside, and it may take 2 to 3 weeks before being able to see the final outcome of the operation. To sum up, the purpose of buccal fat removal is to sculpture the face through removing an anatomical structure which exists in all people. And it's obvious for some and maybe less obvious for others. The outcome of the operation is really great. Of course, you have to decide for yourself whether you need to have it and if it will offer you the perfect image that you need. Liposuction is performed in the facial area. We need some minor incisions in the ear area and under the ear so that we can access all facial areas perfectly. When patients decide to have a liposuction in the facial area, then we have to apply pressure through a facial mask. And it's very important to keep the skin very well and to prevent fluids accumulation. It's a pleasure if you like the video. Don't forget to support us with a like and a comment. If you want to watch other videos and information about plastic surgery, please subscribe and follow the videos that we post in the next weeks. My name is Dr. Alawi and I'm very pleased with you. See you next video. Goodbye.